The University of Arizona is critical in providing the latest, most innovative, high-quality cancer care to Southern Arizona. I've been the chair of the board for the last 2 years, and when I came in, I used my experience in the past to try to make the board a lot more efficient. Being a physician, I have the skills to talk to our academic researchers, and being a family practice physician, I can also speak to community members in general. I've been medical director for the tribe officially since 2005, but I've also been their family practice doctor since 2002 on the reservation here in Southern Arizona, South Tucson. The issue is that Native American tribes in general, but I can only speak for our tribe, there were issues of trust with not just the U of A, but any major research institutions. The Native Americans are usually the ones that are most affected by cancer rates and cancer burden, but they're still in the process of historically creating their own destiny. And with that, they're trying to control what happens to them in dialogue with the general population. Native Americans in this country usually have the highest chronic disease burden. They're usually the lowest on the economic scale. Native American tribes also have a unique relationship with the federal government, where the federal government through the Indian Health Service runs a lot of their programs. And some tribes have been able to become independent. We are one of those tribes. That means the tribe runs its own show. The importance of that is that the tribe now creates a strategy and can look at what resources they have and decide where they go. For me, the important term to understand is what today is called social determinants of care. For example, if you're the poorest people in the state per capita income, if you have the highest disease rates, right, but let's say you don't even own a car, it's really hard to get to real basic things. So for us, the greatest challenge for the tribe is how do you take the resources they have and obviously through our health department address them. I'm very excited that in my short experience with the Cancer Center, I believe they made a commitment to trying to really have a great relationship with us. They're also working with other tribes like Tohono, but I'm speaking from my experience, where there's more opportunities for collaboration. For example, the tribe does not have all the resources to really do what they want to do. We don't have a hospital on site, where we could have research studies go ongoing. We don't have our own IRB, which is a committee that looks at studies to make sure it's done right. So these are areas that I believe the University of Arizona Cancer Center can help us create those things. What I'd like to see happen is with that, then work with the University of Arizona to create recruit kids even as young as junior high who want to go into this and support them so then down the road the future cancer researchers in these areas could be Native Americans from these folks that have grown out of this system. I think that is certainly possible. I think it'll take time. I might not be here when that happens, but when that happens, that is going to be incredibly important for the tribe to have its own people participate with the U of A and being partners actually as professors doing this research in all areas.